Mastoidectomy. It is a surgical procedure that removes an infected portion of the mastoid bone when medical treatment is not effective. It is performed to remove infected mastoid air cells resulting from the ear infection, such as mastoiditis or chronic otitis, or by inflammatory disease of the middle ear. The mastoid air cells are the open space containing air that are located throughout the mastoid bone, the prominent bone located behind the ear that projects from the temporal bone of the skull. The air cells are connected to a cavity in the upper part of the bone, which in turn connected to the middle ear. Aggressive infections in the middle ear can thus sometimes spread through the mastoid bone. Mastoidectomy are also performed sometimes to repair paralyzed facial nerve. Causes. A mastoidectomy is often an initial step in removal of lateral skull base neoplasm, including vestibular schwannomas, meningioma, temporal bone paragangliomas, and epidermoids. Complications of otitis media, including intratemporal or intracranial suppression and lateral venous sinus thrombosis. Types of mastoidectomy, in that canal wall up mastoidectomy and canal wall down mastoidectomy. Canal wall up mastoidectomy, in that combined approach, intact canal wall mastoidectomy, closed technique. Canal wall down mastoidectomy, in that radical mastoidectomy, modified radical mastoidectomy, open technique, front to back mastoidectomy, etichoandrostomy. A simple mastoidectomy consists of opening the mastoid cortex and identifying the antrum. A complete or canal wall up mastoidectomy necessitates removal of all the mastoid air cells along the tegmen, sigmoid sinuses, presigmoid dural palate, and posterior wall of the external auditory canal. A canal wall down mastoidectomy includes a complete mastoidectomy, in addition to removal of the posterior and superior osseous external auditory canal. The tympanic membrane is reconstructed to separate the mucosal lined middle ear space from the mastoid cavity and ear canal. A modified radical mastoidectomy is identical to a canal wall down mastoidectomy, except the middle ear space and native tympanic membrane are not manipulated. This procedure is useful when there is no extension of cholesteatoma in the middle ear space or middle to the malleus head or incus body. This procedure is often indicated in patients with a cholesteatoma in their only or better hearing ear. A radical mastoidectomy is a canal wall down mastoidectomy in which the tympanic membrane and ossicles are not reconstructed, thus exteriorizing the middle ear and the mastoid. The eustachian tube is often obliterated with the soft tissue to reduce the risk of chronic atria. A skin graft can be placed in the middle ear to reduce the risk of mucosalization and atria. Complications: persistent ear discharge, hearing loss, facial nerve injury, temporary dizziness, infection including meningitis or brain abscess, temporary loss of taste on the side of tongue.